Hi, I'm Sandy Shtab with Healthesystems. I'm the AVP of Advocacy and Compliance, which means that I get to interact a lot with regulators in the states to ensure that Healthesystems and our customers are in compliance with all the regulatory requirements in our complex system of workers' comp. Healthesystems has been in business since 2002, and the company came to be because there was a system-wide problem that needed solving. At the time, there was no way for a payer to ensure that they could manage all of the pharmacy information on a claim. That meant that prescriptions that might have been dispensed by a network pharmacy, a retail pharmacy, an out-of-network pharmacy, or even a physician could not really be managed properly. So our founder, Ron Roma, developed what was an extremely unique solution at the time. He brought that system to be so that customers could truly manage their prescription drug spend and also provided some clinical oversight to the medications that patients were getting. Since those early days, Healthesystems has continued to provide innovative solutions in the marketplace, whether that be through network management tools, vendor performance scorecards, or clinical oversight. And that allows customers to make more informed claims decisions and improve outcomes on their claims. Healthesystems is really transforming the way that care is delivered in the workers' compensation environment. It's not a secret that healthcare is so complicated, even for people who truly understand our healthcare system and insurance. So we're putting the patient at the center of care. By doing that, we're giving payers a holistic view of that patient and speeding the delivery of care. And all of that helps the injured worker on their path to recovery. I think one of the biggest challenges is the pace of change as it relates to technology and how that affects how insurance claims are handled, how workers receive their care, and the fact that there is very little interoperability between the different systems that insurance carriers and third-party administrators need to work in. So you have a system that differs from state to state, whether the patient is in California, Florida, Texas, or New York. There's different rules that are in place, and then managing not only those rules, but the care of the patient, the flow and delivery of information, and then being able to put all that information in a single place and really do something with it. Regulations have not been able to keep up with the pace of technology changes. And so one of the things our industry really needs to focus on is how do we modernize our systems so that those regulations are not a barrier to progress. I get really excited when I see the tools that we're developing here to help the claims adjuster and medical case manager really service that injured worker in a better way. There's so much information that's constantly coming at them. They need to manage referrals from doctor's offices, schedule therapy services, get durable medical equipment to the patient. And by providing all of that information in one spot, we're able to not only speed the delivery of care to that patient, but we give them insights into maybe some risk factors on the claim. Could be that there's issues with the provider, potentially fraud, waste, and abuse, delayed recovery. All of that information is really at the claim and medical professional's fingertips. That means that that injured worker gets better care, that any risk factors are identified early on, and we help speed the recovery of the injured worker. Ultimately, we want them back to work. Healthesystems first joined IAIABC in 2008, and the purpose at that time was to get more up to speed on the EDI medical data reporting requirements. But we learned quickly this organization is about so much more than medical data reporting. In fact, there are multiple committees that we participate in, whether it is the Medical Issues Committee or Research and Standards. It's a place that brings together so many representatives from our industry and puts them in the same room with regulators from all over the country. There's no other place that you get this many regulators actively involved in discussions with people that represent the different supporting areas of the claim process. And that's what makes this organization really invaluable to Healthesystems. We're excited to continue as a member there. Some of the things that we're seeing as regulatory trends in workers' compensation are happening out in the general marketplace, but they trickle into workers' compensation, usually a little slower than they do the rest of the world. Those things are the impact of medical marijuana as a medical treatment option. Medical marijuana is really gaining acceptance out in the world, and so it probably won't be very long before we have the ability to do more studies and truly understand how marijuana can be used for all different types of treatment, and that will affect workers' compensation. It's already affecting workers' compensation in a number of states. You have first responder benefits. States have really made a concerted effort to ease the process of getting benefits for PTSD or even some kinds of cancers for first responders, firefighters, and some states are even taking a more liberal approach and looking to expand that to dispatchers, people who take the phone calls around events like shootings and maybe catastrophic events. You also have formularies as a hot topic in workers' compensation. There are many states who have already implemented a state-mandated formulary, and more states will be doing that in the coming years. You also have the impact of artificial intelligence and machine learning that will definitely transform the way that healthcare is delivered, and not just healthcare, but data and information that's used in insurance, medical services, just business to business type activity. That's all coming down the pike. And really, there's a lot of change that's needed to ease the progress of these things. We have regulations that were developed 50 years ago or more at a time that none of this stuff was really even a dream to happen. So modernizing our regulations so that you break down those barriers for things like telehealth, or even the ability to process a claim without having a wet signature on a piece of paper. Those are the kinds of things that we're going to see happening in our system in the next couple of years.